was just going to say, I really think that we need to really push prevention much more, especially when it comes to healthcare, and give people incentives to stay healthy and exercise. You know, pay for gym memberships and things like that. Nutrition. People trying to be more health conscious, and I don't think that anybody's really pushing those.
Well, on this matter of prevention, for example, I assume you have some senior centers in this area, right? There are 15,000 in the United States. They don't get the utilization rate they should. I think we could transform senior centers so that many of them would provide more health promotion, disease prevention, computer capability so they could be in touch with their grandchildren. I have one relative in the family who's in her 90s. She's on the internet talking to her grandkids. I mean, there's no reason why, regardless of age, you can't be advantaged by all the modern technologies, including good physical fitness programs.
Anything else? Yes.
My mother lived in Buffalo, and when she had a lot of complex health issues, she benefited from a program that they had there where they had physicians who specialized in geriatrics, and they were paid a salary rather than the traditional reimbursement method. Now, she really benefited from that type of care because the doctor had the time to look at everything, and I think the hospital's reason for doing it was to prevent hospitalizations. Is there any kind of a movement or towards more centers like that where a doctor would...
You'll have to help me a little bit. I'm sorry, I have a little hearing impairment.
She was explaining that her grandmother was in a nursing home where the physician was based, his pay was, it was a center?
It was in a hospital had a physician.
But he was under salary.
Yes. Not under the...
Well, as you know, some of the greatest hospitals in the United States, Cleveland Clinic in Cleveland, Mayo Clinic, are all salaried physicians. The Veterans Administration, too. I always laugh when we talk about socialism in medicine because we've had that in the Veterans Administration since the 1920s. Since the 1920s, there have been doctors that are paid by government. That's called the Veterans Administration. So when there's a salary, it's a lot different from all of the financial incentives that can be, forgive me, can be corrupting. And it's I think, a lot to be said about Mayo Clinic and about Cleveland Clinic.
Dr. Butler, I wonder if you'd speak to end-of-life care and what kind of improvements and changes you think will happen in terms of end-of-life care.
End-of-life care, what changes and improvements?
There have been a lot of changes. There was a foundation called the Open Society Institute that funded for $45 million over a 10-year period a project called the Project on Death in America. I was privileged to sit on that board. The contribution was enormous. It really changed a great deal of medicine and end-of-life care in American hospitals, in prison systems, in clinics, and various places. I think the concept of prearranging and deciding to have a health proxy, as you do in New York State, and to think a little bit about the end of your life is something we should all do. Otherwise, we risk the possibility we may not want to be in a terrible situation. So this death panel thing is a big fake. I mean, that's not for real. I mean, what we really need is for all of us to be a little bit planful about the end of our life. We discovered that by introducing better end-of-life care, for example, in Oregon, where they have the physician-assisted dying, that the number of persons that asked for physician-assisted dying was infinitesimal because people felt assured that they were going to get good care at the end of their life, so they had no wish to kill themselves. So I think end-of-life care serves a lot of purposes, including the dignity that you can die with rather than having to feel under constraint with a stroke that leaves you totally unable to talk or move or whatever.
I have time for one more question. Yes.
What impact do you think national health insurance would have on medical malpractice suits?
Medical malpractice only accounts for about 2% of all the health costs. It's been exaggerated. That's partly because of a political issue. Namely, the trial lawyers always support the Democratic Party, not the Republican Party. So it's been understood. I can understand it. I'm not being critical here. I'm just saying it's therefore understandable the Republicans would talk a lot about the malpractice issue. But I just saw a study the other day, and it only runs a little over 2% of all healthcare costs. Now, there are doctors that practice defensive medicine, and we've got to help them understand better that they don't need to do that. And of course, if we provide adequately for people, we know in Europe there's very little malpractice issue because people don't have the constraint. I don't mean constraint, they don't have the impetus because they've already had care that's been affordable to them. So they don't have the impulse to go running around and suing. I don't say it's not a problem at all, but it's only about 2% of all the health costs.
Okay. Just a few well, first of all, thank you so much.
Thank you all.